Hi everyone. We're going to be looking now at the first two bones of the upper extremity. These are on the appendicular skeleton. And the first two bones we're going to be looking at are the scapula, this looking at its anterior view, looking at its posterior view, and also the clavicle, which is also known as the collarbone. So you may have referred to the scapula as the shoulder blade previously, and now we're going to call it the scapula. And this you might have called the collarbone. We're going to call it the clavicle. A couple of things you'll notice right away is that there are a lot of bumps and a lot of things that stick out on the scapula and a little bit on the clavicle as well. You can see some very large projections right here, as well as on the end of the scapula over here, a very large projection sticking out. Another big ridge over here. These are all called processes, and a process is something obviously that does stick out on a bone, and its purpose is it provides an attachment site for muscles. So if we look at this part of the scapula right here, this is known as the spine of the scapula, and we have muscles which actually come down, such as upper trapezius, and attach right onto it. Up here on the called the superior angle of this being the right scapula, this is the attachment point for one key muscle we're going to learn called levator scapulae. So for now, just know that a process is a piece of bone that sticks out and is an attachment site for muscles. So let's just go over the key bony landmarks or the key processes for the scapula. As mentioned, we have the superior angle. This is the medial border, the inferior angle, the lateral border, the glenoid fossa. Fossa is a dish, F-O-S-S-A, fossa, glenoid fossa. This, by the way, is the socket for the head of the humerus, which will fit in here when we'll look at the glenohumeral joint. This is the coracoid process, sometimes called coronoid, as you'll see in the image below. It is often spelled a couple of different ways, just to make things a little confusing. Here is the spine of the scapula. This flat part is called the acromion, the acromion. Notice that the acromion is the point where the clavicle meets the acromion. This joint here is actually called the acromioclavicular joint, or the AC joint. This is where shoulder separations occur. And then we have another very large fossa on the anterior surface, or the front surface of the scapula. And this is for a large muscle which resides here called subscapularis. So those are the main, that's not all of them, but those are the main bony landmarks of the scapula and the clavicle. And again, processes are attachment sites for muscles.